Friday is a deadline for a massive railway strike in this country. It is the end of the 30-day cooling off period, federally mandated cooling off period. Biden made that declaration 28 days ago, 27 days ago. I can't do the math. We're talking about 150,000 or so, I think, railway workers. It will impact Amtrak insofar as Amtrak rides on those same rails. And so Amtrak will still have service, but it will be greatly diminished because there won't be necessarily the same sort of workers working those rails. There are two unions that represent the majority of workers. There were multiple unions, I guess, that about a dozen unions that were involved in this. And 10 of them, I think, basically had come to a deal, but they will join these other two unions going on strike.
And they're going to join them because that two union, it seems, so
well, they have the vast majority, right, anyways.
So it's like nearly 60,000.
Yes.
Workers.
I think even, at least there are 115,000 workers, and about 60,000 are in those two unions. The big issue is really no longer money. They have agreed more or less on raises for the railway workers. But the biggest issue is basically working conditions. They have the workers on hold for several days at a time. They work 12-hour shifts with little notice, and they are penalized for calling in sick. You cannot go to see a doctor, even unpaid. First of all, there's no paid sick leave. There's not even no unpaid sick leave without getting fired. And 99% of the participating members of the Locomotive Engineers Union voted in July to authorize a strike. So they're at least pretty darn close to the full 115,000 are going to go on strike.
How is that kind of sick leave or these kind of benefits not federally mandated, given the railways
sweetheart deal that they have on all these? That's
That's just insane.
It's insane. But it also should be, you could have Trump come in and or DeSantis and reverse that. What you need is they need to come to a deal. There have been multiple times where apparently the industry has claimed that the union will not go to mediation, and they went to the National Labor Relations Board, and the National Labor Relations Board reviewed those claims and booted them. So it really comes to how much will the Labor Department, how much will Joe Biden lean on these, and I don't know what he could bring to bear in terms of actual material implications for these carriers. And incidentally, the carriers reported record income from their operations last year, some of the large freight carriers. So this is not this again is really just about controlling labor in many respects. So we will give you an update on that. If you have stuff that is absolutely essential to you, like if you are someone who has medication or other things that could potentially be disrupted by a large disruption in the supply chain, you may want to stock up on stuff.
Growing up in North Dakota, the one sort of unionized industry where I was aware of what a unionized worker was the rail workers. And I mowed lawns for a guy who was the best paying guy I mowed lawns for, who worked for the railroad all his life and had a really good wages and retirement benefits.
Yeah, those retirement benefits are probably gone now.
In terms of like what, just a pension? That's probably.
Yeah, well, I mean, at one point in this country,
market-based.
during the Reagan years in particular, it started. We moved from a defined benefit pensions, which means that you are guaranteed to get X number of dollars per month in retirement, to a defined contribution program, which means that you are, your inputs into that pension fund are fixed, but your outputs aren't. And often what happened, they started to loosen up some of the regulations on pensions. They introduced the idea of a 401k, which has been an experimental disaster. It has been just a disaster in terms of like people's ability to save this money over the long term when they have control over it.
But hey, it funneled more money into the stock market as opposed to pension plans that would guarantee certain payouts for retired people.
It certainly expanded the sort of like where people were going to pay for these things. Now, what a company would do is they would take this money and they would invest it. Sometimes, part of it was certainly in the equities, but probably largely in more fixed rate things, so they could really determine and make sure that they were going to get the returns that they anticipate. But a lot of them, things started loosening up. And when you don't have a defined benefit, the company basically says like, well, we can play loose and fast with this because we're not guaranteeing you any types of return. We make, some of the, we can make some of the slush funds on this. We can make, so we'll invest, or maybe we won't invest everything, or we'll just assume that the rate of return is going to be higher than it actually ends up being. We need to bring back those pensions, or really, I don't know how we would mandate that other than just we need to expand Social Security.
It's also just like such a perfect metaphor or encapsulation for what workers' rights have become over the past 40 years, is like the onus is on you more so than it is on your employer. Without a doubt. And the idea was like, and if we get rid of these defined benefit pensions, people are more inclined to put more money into the stock market. And then you'll get all of that sort of what they call dumb money out of Wall Street.
A dignified retirement brought to you by speculation instead of just guaranteeing it to people.
And hey, if that 401k kind of didn't grow or isn't paying out in the same way, maybe you'd be smart to invest in an IRA as well,
Or
right?
some crypto.
Yeah.
And an IRA is entirely on you. It's sick.
Speaking of sick, we should also say that, one of the things that's going to incentivize Biden to really lean on these freight railway companies is inflation topped forecasts this month. It was presumed that it would be flat relative to July. Again, year over year, we're at about 8% plus. But in July, inflation had basically stopped growing. It had plateaued. It was anticipated the same thing would happen in August because gas prices have gone down. But simultaneously, you have the Fed raising interest rates, which has cooled the housing market, which has, you have less houses coming online in terms of new construction because people are having trouble selling their existing homes, and rents are going up. Food also went up, apparently, and medical care has gone up, in part because you still have 65,000, I think a net deficit of 65,000 nurses, primarily, who have left the business because it is so crappy. Some, 14,000 or 15,000, are on strike in Minnesota because basically the same reasons why the nurses in Worcester went on strike. They are being asked to do too much because of the profit motive of the owners, the private owners of these hospitals. One of the things that's going to incentivize Biden to really lean on these freight railway companies is inflation topped forecasts this month. It was presumed that it would be flat relative to July. Again, year over year, we're at about 8% plus. But in July, inflation had basically stopped growing. It had plateaued. It was anticipated the same thing would happen in August because gas prices have gone down. But simultaneously, you have the Fed raising interest rates, which has cooled the housing market, which has, you have less houses coming online in terms of new construction because people are having trouble selling their existing homes, and rents are going up. Food also went up, apparently, and medical care has gone up, in part because you still have 65,000, I think a net deficit of 65,000 nurses, primarily, who have left the business because it is so crappy. Some, 14,000 or 15,000, are on strike in Minnesota because basically the same reasons why the nurses in Worcester went on strike. They are being asked to do too much because of the profit motive of the owners, the private owners of these hospitals. And so you're having nurses who are overworked. They are being required to care for too many patients. They are worried about the health of the patients. They're getting paid too little for the work that they're doing. And 3 days out, that's it. They'll be back in a couple days. They're being paid. They're apparently the hospitals are paying traveling nurses to cover. But we'll see. We'll see where that ends up.